Hi, so tell me your name, where you're from, and your background.
Okay, my name is Raymond Wong. I'm a hematologist working in the teaching hospital in Hong Kong.
Great. And how did you first become interested in Castleman disease?
Well, I think I'm working in the regional referral center for hematology patients. So we got quite a few patients with Castleman disease referred to our center. And some of these patients, we have been taking care of them for more than 10 years. And so we have been very interested to see how we can better understand the disease and how we can provide better treatment to these patients. So a couple of years back, we joined the multi-center clinical trial using the new drug cetuximab in the management of these patients. And so it also helped us to gain more experience in using some new treatment for our patients.
Great. And then how did you get introduced to CDCN, and what role do you see them playing in advancing research in the future?
Yeah. Because I joined the clinical trial, so that's why I have sort of established a collaboration with other investigators and also to the community who are interested in, looking into the disease, the Castleman disease. So I was invited by David and the other, scientific advisory board members to join the group, and now I'm a member of the scientific advisory board of the CDCN.
Great. And then what new advances or research that you see out there are you excited about for the future of discovering new breakthroughs for the disease?
I think Castleman disease is still a very rare disease, and our understanding about these diseases as well as the treatment is still quite limited. So we are actually very interested in understanding the pathophysiology of this disease, how we can improve our diagnostic accuracy, and how we can improve the treatment of our patients. So I think there are lots of works that we can do, and I think that the CDCN is a very exciting kind of group because we have gathered a team of experts from different parts of the world who are interested in Castleman disease, and it's a great foundation for us to actually work together to hopefully to solve all the mystery of this disease.
Right. And what would you say to patients out there who maybe are newly diagnosed or who are searching for more information?
I think in terms of, for example, the diagnosis, I mean, we sometimes have got a lot of challenges in making a correct diagnosis for these kind of patients. Now, most commonly, they present with some non-specific symptoms or maybe a lymph node, a mass. They may seek advice from the family doctor who end up, these patients may be referred to multiple specialists for advice. And at the end, someone may have taken out the lymph node and they find this is not a lymphoma. But then a lot of time we face the challenges because the diagnosis may not be that easily made, because even the pathologists and also the clinicians may not be that familiar with the disease. So in the patients that we have seen, a lot of time, the diagnosis may be delayed, and by the time they reach us, they may have been having a disease for quite some time, and obviously they may be having a lot of symptoms, the conditions may not be that good. So there's, I think, a lot of work that we need to do to increase the awareness of the physicians, the pathologists, the patients about this disease, and hopefully we can establish a correct diagnosis early in the course of illness and give them the appropriate treatment.
Yeah. And then for the clinicians like you and other researchers out there, how would you encourage them to get involved?
Well, I think for the we need to encourage all the physicians who actually are treating patients with Castleman disease to join the network. Okay? Because joining the network is the first step that we can actually share our experience. And hopefully we can build up some registry, we can sort of build up some sort of discussion channels, so we can actually improve our understanding of these diseases. So right now the problem is that the patient's clinical features, even the pathologies, even the laboratory findings can be quite heterogeneous. And we certainly need to get a bigger data pool for us to understand more about this disease. I suspected that even patients are having the multicentric Castleman disease, there may be some different subtypes and with different presentation or maybe different clinical course. So we need actually a bigger data pool actually for us to study more so that we can understand how to manage this patient.
Thank you so much.